started your timer and here is your question. Right. So if you have read and understood, considering it clinical examination station, kindly begin.
Yes. My name is Dr. Khawar Rahman, one of the surgical candidate. I will wash my hand. May I ask your name and age, please?
I'm 23 years old, Tina.
Okay. I will ask for a chaperone and I will expose the patient. Gown will be removed with the dignity of the patient, and the patient is standing in front of me. I will examine the both shoulder joint.
Yes. Why do you need chaperone?
Because it is a lady, I think so.
No, not in this one. Okay. Without chaperone, continue, please.
Okay.
How much exposure you'll do? You'll keep the dignity, she'll keep the undergarments, and she'll take off the gown. And then
Yes.
what would be the position of the patient?
Patient will be on a standing position.
Okay.
Standing position.
Yes.
And I will inspect from in front, then side, and then behind.
Yes.
The shoulder
Yes.
joint will be examined, and
Yes.
any scar, any deformity, I will check. Then
Yes.
I will ask the patient to press her both hand on the wall, and then I will check any winging of the scapula. Then
Yes.
I will ask the patient to copy some
Movements. Yes.
abduction, then complete abduction, supraspinatus deltoid, and other muscle will be checked. Then I will ask the patient to anterior flexion.
In
and
other
then,
words, you'll check the active movements first.
yes, active movement first. Then before it, I will palpate the shoulder joint. Both shoulder joint, I will palpate that temperature, tenderness, coracoid bone, and spine of the scapula and clavicle, and the axilla and the lateral side of the humerus of the both. And I will do the painful joint first. I will examine it if the patient allowed me. If not, then I will go to the good joint. But my preference to detect the problem in the painful joint. Then I will active movement, and then I ask the patient to both arm in front and then extend with the elbow flexion, and then ask the patient to keep your on your back and both hand in one by one. Then I will do the scratch test.
Can you explain
shoulder.
again? Which test are you doing now? By hands on the back?
I will ask the patient to keep his dorsum of the hand in between the two scapula.
Okay.
I will check.
Yes. All right.
Subscap.
Yes.
Then I will
yes.
ask the patient to do the scratch test shoulder, head, and the back. And then after that, I will do the passive movement of the patient, both hand in front, and then I will give resistance, and patient will extend his both hand. Then I will ask the patient to upward flexion and with my resistance, then downward with resistance. Then on the back, similar position between two scapula, and I will put resistance. Patient will push my hand from the back. Then I will do the John Kennedy test and check the acromion joint pain. Then the near test I can do. Then I can do the empty can test and painful arc syndrome test, that I will elevate the hand and hand will be go down actively by itself. Then I can do the anterior dislocation test, and then the and then the posterior dislocation test, that is called jab test. And I will complete my examination by doing the neck examination and the elbow joint examination. I have completed my examination.
You still have 2 minutes.
Yes, madam. I have still
So
2 minutes.
what else you'll do to complete your examination? Because you still have 2 minutes, so I have to ask you. You'll do the neurological examination of
You
what?
can describe the test.
Neurological examination of the upper limb.
Yes,
Upper limb neurological,
sensory and motor.
neurovascular exam.
Yes.
Neurovascular examination will be done of the upper limb.
Yes.
Yes.
Someone
Yes.
asked a question. Yes, please.
Yes.
No, you can describe the test within these 2 minutes.
Yes, you can.
You
All right.
mentioned-
If you tell me you asked for painful arc test, how would you expect the patient to react? Because patient has characteristic pain, which has been explained in the STEM. So what would be your findings, please?
At 60 to 120 degree, patient feel pain at this degree.
So patient will, yes,
supraspinatus
will not be
tendinitis.
able to
Yes. Do this test.
abduct, yes, of between 60 to 120. All right, very good. Okay. What else? Which other test will be positive?
MT can test can be done. Anterior dislocation of the humerus and jab test can be done.
Okay. All right.
These-
26 seconds left. Can you start summarizing your examination, please?
Yes, I examined this 23-year-old lady having pain in the shoulder, and on examination, shoulder joint look normal, and all on the right side, the movements are restricted, especially the painful arc syndrome between 60 to 120 degree, and other tests are painful in the right shoulder more
Yes.
than the left shoulder. So it
Okay.
is the painful arc syndrome.
Right. Any
Supraspinatus.
other differential diagnosis you will consider for this particular patient?
Yes, rotator cuff syndrome, that is
Okay.
trauma to the shoulder joint.
Rotator cuff muscle rupture or trauma. Okay. How would you confirm your diagnosis? Would there be any investigations that you'll ask for?
I will do the X-ray and ultrasound of the
Okay.
shoulder joint.
Right. And
MRI I can do.
okay, but since it's it's impingement syndrome, so the clinical examination is the most important, which you've already done. Okay, what are the advice or the management that you'll give to the patient or you'll suggest to the patient, please?
I can treat the patient conservatively first, and I will give analgesia, rest, and physiotherapy and exercises. So maybe her pain is relief. If pain is not relief, then I will refer her to the orthopedic surgeon for a different surgical option for this full arc syndrome to relieve this swelling of the tendon.
Okay.
Or I can inject
since the patient-
substeroid.
Yes.
Steroid
All
injection
right.
can be
Okay.
done.
Before you refer, you'll try
Yes.
even the steroids. Okay. Patient is a professional swimmer, athlete. When do you think she would be fit to perform in her matches or contests?
More than 6 months, 6 to 9 months, I think
It's
so.
after 6 to 9 months rehab. Okay.
Yes.
Right. Anything else you would advise to the patient?
I will advise to do not do first swimming, avoid swimming first of all, and
Until yes.
until
recovers.
her pain is relieved.
Good, good. Okay. Now, my question to you, why would you, now Bell has gone, okay? I want you to tell me or convince me why you wanted to start with the painful arm or shoulder.
Why you start? Because scenario is this, that she has impingement.
Yes,
Like,
but
it is written.
always begin with the pain-free side first.
Yes, this is confusion, madam, that I will start with the pain-free side, then I will all the time in the normal joint, then I do not know how to pick the finding in the problematic joint. It will take time. But I
If
think
there
you
is
are.
if there is impingement syndrome, have you
Hmm.
ever examined patients with impingement syndrome?
Mm,
Once you're examining them, even if they're pain-free at that time, once you're examining them, you realize that they have impingement, and you notice it's evident.
Yes. So,
And
madam, your advice is that if patient has right impingement syndrome, I will start from the left joint, which is normal.
yes,
I will
and
start
then
from the
you can
go
give
to.
explanation that since patient has acute inflammation or acute condition of the other side, so I'm starting with this. So you can even say to the patient, okay, since you have complaint or the pain on the right side, so let me ask you to do these movements on the left, then do them quickly, and then ask the patient to do it on the affected side. Bell would go, you would not be able to complete, and then you can justify yourselves. Okay, but if you ask them to do it quickly on both sides, then some of the tests they can do it simultaneously. Like you ask them to have the arms behind both scapulas and then against the wall when you're testing latissimus dorsi and all these. So some of the tests can be done simultaneously, but inspection also can be done simultaneously. First, you'll focus on the pain-free side, then on the painful side, and then you ask them to do. So it can be done. It's little, it needs little practice, but it can be done, and it can be done within the given time. And you can easily say that you asked to do it in the pain-free side first, because you wanted to know that patient was having full range of movement, and now you are doing on the painful side. They will understand. And always active movements first and then passive movements. Good.
Yes, madam, I understand. That is a big confusion. That is correct.
Yeah, that is always you have to keep in your mind. Active movements are when patient you are ordering and patient is obeying itself.
Yes, madam.
Passive movements when you are making them move, then you realize what are the range of movements patient cannot do easily himself or herself.